Hey, Sue, how are you?
Hey, Rich, how are you? I'm so excited to be here.
I'm so happy you're here as well. I think you got some really great stuff to share. And I'm sorry the video from the previous session ran over by just a minute.
Oh, that's fine.
So everybody's kind of cruising over into the room right now. Hey, Steve, glad you're here. Glad everyone's here. You know how to, I'm going to introduce Sue Fetzner, who is a certified podorthist and health and fitness educator. And she's got some really great stuff to share on feet, fascia, and fitness. Probably some things we don't really think about very often, but that we should be thinking about. So I'm going to turn it over to you, and you take it away, young lady.
Okay. Hi, everyone. I'm so excited to be here, and Rich is right. Many of us are podorthists. I see podiatrists and doctors and PTs and all kinds of people on here, and we spend most of our day with feet, but I'm not sure all of us always understand how much it affects the rest of our body. And this is a little bit new in the field of medicine, sports physiology, and that, but we're just going to jump into it, and we're going to spend a little bit of time on really what do our feet have to do with the fascia, and how can we get fit by just paying attention to our feet. So it'll be a little bit different. We're going to do a little bit of an action phases throughout the presentation. So I want everyone, because everybody probably ate lunch, maybe you just drank a Coke or a candy bar. So we are going to, let's see, how do I get a full screen?
I want to share your screen.
Can they see me?
We can see you, so I can.
Okay, so I'm going to move over. All right, so what I want everybody to do, there I am. So I want everybody to sit in their chair and come to the edge of the chair just a little bit. We're going to do a little bit of an action before we get into the PowerPoint. So I want you to take your fingers and take your thumb and just put it right on your first knuckle there and go back and forth. So we see a lot of exercises or movements where people are touching their fingers. That actually activates mind to muscle to the end of the fingers. We can do the same thing with the foot. But now I want you to take your thumb and put it over top of your finger. And then you can do it fast. Okay, now take your thumb, bend your finger. Now straighten it way up high, and at the same time, stretch all three fingers as far as you can. So your hand looks like that. And release. You should feel a lot more going on with that hand. Now you can feel your arm. You can feel all the way up to your shoulders. And one more time before we get started. Thumb over finger, point. Now stretch your arm out. Twist your arm. Bring it back in. Do you feel it? Push out, twist, twist, bring back in. This finger is now in alignment, and you get a lot more fascia activation. So let's see. Let's go to share screen. Slideshow.
Hey, Sue.
Okay, so just a little bit of yes.
See that little bar where it says stop sharing and it says hide right next to it?
Okay.
Click that.
Okay, there we go. So just real quick about me, I've been in the field of health and wellness and fitness for more years than I want to admit. And I actually came into being a CPed later. So I was interested in how the body moved, how it worked, how to make it well, all of that for what now seems my lifetime. And I got interested in podorthics because I was working with a lot of diabetic patients and doing workshops, helping them get rid of belly fat, doing all kinds of coaching. And I had a huge client base of diabetics. And I found out that they really had trouble finding shoes and footwear, and I saw all kinds of biomechanical problems. So that's how I personally got involved with being a podorthist. So I have, over my lifetime then, in the last so many years, I've been putting together the feet, fascia, and fitness all in one. So I call it my 3 Fs. So what do we have to do? What do all 3 have to do with each other? The feet is our foundation, and fascia covers, intertwines, and makes up our body. We've all talked about fascia over the years, but I know that I didn't realize how massive of that tissue was throughout the body. And then we need fitness for our quality of life, or it suffers. So if we're on purpose with all 3 of those things, we'll have optimal health and fitness, and we can also use our feet and the fascia to help prevent and reduce health challenges. Johns Hopkins is spending a lot of time on fascia and fascia research more recently, and they're finding that it has a major role in every single move that you make. So if I were to take this little toy here, and you can see the fascia would be these black little lines, and every single time one gets moved, everything moves. And so they're finding that it's more than just the end of a muscle or wraps around a muscle. And this has been in research now for the last 20 years with different people in Europe. Germany is big on this. The sports industry is getting to really understand how big this is. So what is really fascia? All of us have talked about fascia. We've heard about fascia. We see fascia. The podiatrists who are on, they see it when they do surgery. Fascia is not new, but how intense it is. Fascia has nerves that makes it almost as sensitive as skin. And this is one of the areas that I've been fascinated with because how much we can actually change the body. Fascia is a 3-dimensional spider web. It's gluey, and you can actually see this. It looks like fascia, but this is actually a real spider web. But our fascial tissue looks exactly like this throughout the body. They used to think that it just wrapped around the muscle, and then we talk about tendons and ligaments. Then they realized that it's not just the muscle, it's each segment of the muscle. Then they realized it was each fiber of the muscle. And now they believe that fascia actually covers every single cell of our body. What is its function, or what has been our belief of its function? It mostly stabilizes and closes. It separates the muscles and other internal organs. But again, as we go on, you'll see that it actually intertwines every single thing that we have in our body. This was my first client. When I started to learn more about fascia and the use of the feet and how important it was to fitness, I tried it on a client, and this is my first client. She had an extreme case of autoimmune disease with fibromyalgia. You can see the lymphatic issue going on. If you look at the picture on your left on your screen, you can see how there's a lot of bloating going on in all 3 of those pictures. But if you look down at the bottom of her legs, you can see that her biomechanics is way off. And you can see some of the other symptoms that she had. Once I started working with her with the feet and the fascia and using it to actually elongate and activate the fascia, then this is what happened. Her first goal was to get rid of the pain. That's actually why she came to me. But after that, this is what happened. All the symptoms of the fibromyalgia went away. All the meds went away. All the mental problems, the fibro fog, the weight. She went from a size 12 down to a 4. She had not been able to work. She was able to work. And you can see a couple years later that she looked much younger. I've kept track of her. And this is her 18 years later, has an active lifestyle, optimal health. She's still on no meds, no diagnosis, no pain, extremely high energy, quality of life. And this is all by activating fascia, paying attention to some nutrition, and using our feet. So our feet are extremely important. As we move forward in the fascia world, we're hearing that there's an old definition and a new definition. So the old definition is what we all know. When I was in college learning anatomy and physiology, we learned all the muscles, we learned how they were taken apart. You would learn each muscle or each ligament, what name it was, what its function was. But we didn't always talk about how it worked as one whole unit. And we see this with cadavers. Everybody's, cutting pieces out, and that's how we learn. We needed to do that. We can see here, this is fascia tissue. But what they're finding out is the fascia, and maybe some of the surgeons on today would be able to attest to this more, is most of us don't always see the fascia. When we see pictures of fascia, it's dried out. And you can see on the right upper one, you can see how it's more dried out like a spider web. And it's not. It's actually very wet, like a spider web with all the moisture from the morning. So we're talking now about a new definition. If you go out there and do your research, you'll find that there's a new definition to fascia. It's not just the muscles, ligaments, and tendons, or the sacs anymore. It includes all the cells and creates and maintains this network throughout the body in this extracellular matrix. So it's quite fascinating. I think we're going to see a real lot of information coming out in the future. But as you can see, this has been out, some of it's been out, the information, for a while, because the case study that I just showed you, that was almost 20 years ago that got started. So you can see here, it's a three-dimensional matrix. I used to think of fascia as just a sheet, but they're finding it's really more than just a sheet, and we can see how it twirls, and you can see the moisture. This is real muscle, and you can see how moist it is. You can see all your ligaments, some of your tendons. It wraps around, and again, they thought at one time that it just went around the base of the muscle center, but you can see how it runs through everything. And if you could see the ends, you could also see how all these bands. I've been in the exercise world for many, many years, and when I learned all the exercises in sports physiology, I was in college, I went on to higher education. We never talked about fascia, hardly ever, except for the plantar fascia. So this is exciting. Some of the researchers are asking, this is the new idea. Are there really 600 muscles, or is there one huge muscle and everything is divided by fascia? So it's kind of a fascinating thought. And this Van Hagen's, they've done a lot of research in trying to figure out which kind of came first, the chicken or the egg. We're seeing now that fascia is a system, just like the neurological system or the cardiovascular system. When I was in college, the lymphatic system, they weren't even calling it the lymphatic system. It was actually part of the cardiovascular system. So as we hear about new research, find new research, some of you, I'm sure, are involved with some of this. They're actually starting to call fascia a new system, so the fascial system. And again, we talked about earlier that the dissection of the body is what we have done to make everything separate, but in fact, it's not. Everything runs from your toes all the way to the top of your head. It's very important in the biomechanical regulation, just like our other systems do. And they're doing a lot of studying. We need to be studying. We're treating it as a system now, not just in parts. So when we're all working with our feet, I put a pair of shoes on somebody. I've been looking really past that. Like, what are we really doing? How would that really affect everything? And in our last speaker, she was talking about the biomechanics, getting the body back into alignment. That is really, really important for activating fascia. And I'm going to show you that in a few minutes. So again, when one part moves, everything moves. There is not anything that moves in the body that doesn't move something else. And it's when we move one part of the body, the fascia is activated. We all talk about stretching, but I like to use the words more activating and elongating. It is more of a correct term of what's actually happening with the fascia. Here we talk about fascia with our foot. A lot of people understand the plantar fasciitis, the plantar fascia, the Achilles tendon. And when it's injured, we do all these things. But if you look on the right, it's actually part of a whole fascial chain. So we have these fascia chains, and we're not going to get into all that today. It's a lot of that can be its own separate presentation. But you can see where the bottom of the foot runs all the way up to the neck. And some of them go from the foot or the dorsal part of the foot all the way up to the top of the head. They go to the spine. They go to the shoulder. So everything is in this chain. We're not always moving or walking in the chain. So I'll show you that in a few minutes too. So we have these fascial lines. Very, very important. And I'll talk about that another day. So what I want you to do is we're going to actually sit on our chairs. Put your feet so that they're 4 fingers apart. And I want you to put your feet right underneath your knees. So your ankles and your knees are in alignment. Take your feet and put them out in a pronated position. Now I want you to lean back slightly and pay attention to what you feel. Lean forward. Lean back. I personally don't feel much going on in my leg. Everything has been, quote, deactivated. Okay, so now bring your feet in, like subtalar neutral. Look down, make sure they're 4 fingers apart. Okay, now slide them back just slightly. Lift your heels up. Keep your heel, your ankle, and your knee and your hip. See if you can get it in alignment. Now lean back, really pushing your heels up. Lean forward. You can start to feel something's been activated. You're starting to feel the fascia. Now take your toes. Some of you have to take your shoes off. I forgot to tell you that. So take your shoes off if you haven't done that yet. Okay, so now our heels are up. Now, push down onto the mat heads. Push the foot up. Some of you may not be able to do this. Push up on your toes, and you can start to feel even more activation. Now move your toes back and see if you can flip your toes over, your feet over, so the top of your toes, the dorsal part of your toes are actually on the floor. Now lean back. Now you've really activated a fascial line, and you should be able to feel it all the way, at least up to your hips at this point. You're not standing up, so you're not going to feel it all the way to your shoulders. The position of our foot is extremely important in activating the fascial lines in the fascia. Everything is about alignment. When we move in alignment, in biomechanical correct position, and we activate the fascia, then great things start to happen. So why do we need to pay any attention to the feet and the fascia? If you want to have an active, painless everyday life, then you're somebody who would want to pay attention to the fascia. We have patients all the time. I know all of you have patients all the time. Some of them I don't even know. I mean, they can barely get in to your place from the car. We're seeing a lot of people, their biomechanics is just awful. People are overweight. Their feet are pronated. I mean, one of the reasons why they're having such difficulty is because the fascia over a period of time has not been activated or stretched. So if you understand really truly how fascia works in the body, you can, look at some of the benefits. You can reduce pain, increase range of motion. You can nourish the muscles and the nerves. It helps reduce belly fat. If you activate the fascia with your feet and all the way up, you can actually start to get rid of belly fat because it increases the neurokinetic flow. And when you have neurokinetic flow, it will rise the temperature of your body and increase metabolism, which will help burn your belly fat. It helps to regulate blood pressure, creates a healthy heart, increases neurokinetic and lymphatic flow. That's super important for a lot of our patients. We see edema all the time. It will also improve balance, rebuild systems, and more. So it's very important. We talk about, and I've heard about fascia as just like a part of the body. But now it is actually considered a sensory organ. The sensory organ is so important to many of us because we're working with patients with neuropathy. So what they have found that there's nerve endings actually are in the fascia. So there's more sensory, and you can see that right here. There's more sensory nerve endings in the fascia than there are in the eyes and the skin. And I don't know about you, but I had no idea until over the years I researched this and learned this. It's one of the richest organs in our body, and it's embedded with nerve endings. So you can start to work, and you can do it for yourself. Learn some of these techniques, and you will see great things happen in the neuropathic world. So the increase of neurokinetic flow goes from the brain out to the extremities. It will actually help to rebuild and repair some of the damage that's been done. And you can see here also, fascia plays a major role in the perception of posture and movement. And again, that's neurological. Fascia is in our brain. Everything in our brain is covered with fascia. And fascia is everywhere. It is everywhere in our body, throughout everything that we have. It goes, intertwines. So what can we do about that, and what are some of the problems? Fascia is supposed to be hydrated and slippery, and sometimes we think of these sheets, and they would be layers of these sheets. Sometimes we can't even see the layers that are there, but they're, if you can imagine them, different sheets of paper with water running through them. That's really what they're supposed to be like. As we age, as we have bad health habits, we're stressed, all of those will actually inhibit and dry out the fascia. It's supposed to move and slide. If it's not hydrated, it won't slide and it catches. Some of that is where some of the pain comes from. You can see where if you limit your activity, sometimes you're overworked, you're doing the same thing over and over again, the fascia will become very hard and matted. And then it tightens up and we are in pain, or we don't want to get up, which ends up making it worse. So the restrictions in the fascia is also important to us too as podorthists, because it will increase the blood flow, the organ function, and the nerves. And what do we see all the time? We see patients who have cardiovascular problems and nerve issues. So that if some of our patients would understand some of these concepts, it would very much help them. You can also see where if the fascia gets so tight and taut and gummy, it'll actually create adhesions. So many of us have heard the adhesions, and these are the trigger points that you have. Now, if you go back to the client who I had, then that gal, she had a lot of trigger points issues. If you know anybody with fibromyalgia, they have a lot of problems with trigger points, and their feet are in pain all the time. If you're working with just diabetic patients, you might not see that, but I'm sure that some of you have seen that before. So what do we do to have healthy fascia? We have to move, move, move. And it's not just moving, it's moving in alignment and understanding where our body is in space. People think they're in alignment, and I'm sure that some of you have seen that before with your patients. They think they're standing up tall and straight and in alignment, and their shoulders are in alignment with their hips, but they're not. They're leaning forward, their hips are out of place, their ankles out of place, one shoulder's higher than the other. When that starts to get back into balance, then is when you would see very big jumps in what you see with a patient. You have to activate and elongate. Again, a muscle, when we move our arm like this, most movements that we do in the fitness world, or we're just moving outside, we're only using the belly of the muscle and one attachment. If you move in alignment and pay attention to every position that your body is in, you can actually activate and elongate along what's called the full fiber. So the full fiber is from end to end. When you do that is when you activate and elongate your fascia. Okay, so maintain good posture. We're seeing this all the time, right? Everybody sits at their computer. We're on our phones. Our heads are down. We're on our computer. We're hunched. Even as a podorthist, we're down on the floor a lot. We're hunched in our shoulders. And so sometimes if you're doing that all day, you get up at the end of the day and you're like, oh, wow, what happened? So I want you to sit on your chair. Put your feet back where they were, four fingers apart. All right, so I want you to sit up tall, what you think is sitting up tall and where you would think everything is in alignment. Okay, now what I want you to do is take your pinky finger and put it right on top of your thigh, right in the middle of each thigh. Now push down on your thigh. And what happened? Your ribs went way up and release. What happened? Our shoulders started to round. Our chest started to sink in. We're like, oh, a lot of us sit like this and we're tired. So again, take your pinky finger, put it on your thigh. Push down, push down, push down, push down. That is fascia stretching of our core. And now our ribs are up. They should be up all the time. If you stretch that fascia and elongate that fascia in the core, and that's just one movement of the core, there's lots of movements, it will help the heart and the oxygen intake of the lungs. When we sit crunched, we are deactivating a lot of our muscles and fascia, and then we're not getting, it's actually putting stress on the heart, and we're not getting that really intake of our oxygen the way we're supposed to. So again, take your pinky finger. Now, I think I'm going to get off my screen for a minute. Okay, let me see. Oops. Oh, Rich, I might need you. Let me see. Can I go end show to get off? Oh, there. Let's see. How do I get back to the screen, full screen?
I'm here. Just
Rich, I'm having I thought I knew how to get back.
Yep, just X out of the whole thing. X.
The whole thing?
No. Up in the upper, hit the stop sharing.
Well, I have stop sharing or stop streaming.
No, don't stop streaming. Stop sharing.
Okay, that's in the bottom.
Yeah.
Well, if I disappear, I'll be back.
Okay.
There I am. Okay.
Okay.
Okay. So if you have your hands like this, put them down on your thigh. Move over a little bit. We'll do a couple movements. Push down, and we lift up, right? I'm going to go back a little bit so you can see me a little bit better. When we push down, our ribs go up. Take your elbows and bring them in. And relax. See what happens? This is activating the fascia and elongating the fascia. This is not. So if you want to have a good posture and you're putting people in shoes and orthotics and then their posture is awful, it's just this concept can take them beyond the shoes that you put on them and they can get better results. So again, take your finger, your pinky finger, and just hold it there. I want you to breathe in and exhale. Breathe in and exhale. And now round your shoulders. Breathe in and exhale. And breathe in and exhale. And you'll find that it's not as much. You're not maximizing that. Okay, now push a little bit. Just sit up straight. Not pushing on your hands yet. Breathe in and exhale. Breathe in. Deep and exhale. And go out as far as you can. And we're all like deflating a balloon and we go, ooh. Okay, so now take your pinky fingers, put them on your thigh, lift up. We're activating our fascia. Take your elbows, squeeze them in. Now breathe in. You should be able to go a lot further. Now exhale. Keep the ribs up, keep them up. If you go all the way to the furthest point of your exhale, you should be able to feel more of your core. Now, one more time. Pinky fingers on your thigh, ribs up. Okay, now we're going to use the feet. Push down on the feet. Now our ribs up, everything is even more. And relax. Okay, take your feet. We're going to focus on the feet for a few minutes. I'm going to go back. Sit there with your feet. Make sure they're in subtalar neutral. Put 4 fingers between them. Sit so that your buttocks is right at the end of your chair. Now, if we were live, we would actually be working out standing up. We would be doing these moves standing up, but we're in a chair. Okay, so your buttocks is just at the end of the chair. I want you just to tighten your butt muscles. See how you move? I go up. Okay, so tighten those muscles. And now I want you to push down on the floor with your feet. Take your pinky finger. You have to hold that. Take your pinky finger, put it on your thigh. Push down, ribs come up. Elbows in. Can you feel it? Now breathe in. And exhale. Keep pushing. Okay, next time. Lift up your toes. And if you can, try to spread them. Some of you can't even lift up your toes. But if you can lift up your toes, try. You're supposed to be able to lift your toes up as far as you can and spread them like you would in yoga toes. So spread them. Can you feel it all the way up your leg? You should be able to feel it all the way up. Push down on your thigh. Elongate. Everything is elongate. We're activating the fascia from the feet all the way up. Then we're including the hands, pushing down. Breathe in and exhale. Exhale. Now hold it. 3, 4, 5, 6, 7, 8, and release. Is anybody's legs getting tired yet? And if you can hear me, I'm starting to already get into a cardio. So imagine somebody could get into a cardio very, very quickly within a matter of a minute versus 20 minutes And some of this has been documented through some of the medical research. So if we activate the fascia, we can actually help patients or move into helping someone get a cardio workout. I like to use the word move. Everybody hates the word workout. So they can move and help with people who, what do you hear the most? I can't do that because I can't. I can't do that because I just can't. I can't move because I can't. So if we can't, I can't do a cardio because I can't. I can't work my heart because I just can't. I can't move. Well, almost everybody can do something in a chair. So one more. Take your fingers, put them on your thigh. Lift up your toes or your heels. Your heel in that position, the plantar surface of your foot is actually supposed to be able to go up against a wall. So it's a 90-degree angle from your mat heads to your calcaneus. So I don't know if you have on your chair, maybe you have a leg to your chair. If you take your foot, lift your heel up, back it right up to a wall or your chair, and see how much you can get that. Your foot is supposed to be able to, if all your fascia is very healthy, supposed to be able to do a full plantar flexion. So you should be able to point your toes, and from your toes all the way up to your knee is a straight line. I know some of you can't do that. I couldn't do that either at the beginning, so I had to practice. But when you do that, and if you keep the foot in alignment, you'll actually increase the ankle stability of your ankle. We all see that, right? One of the biggest problems that we see with patients is ankle instability. So go back to your feet in subtalar neutral, 4 fingers apart. Lift up your heels, drag them back. Drag them back just a little bit further to see if you can stretch that. Now see if you can go under your chair and actually, again, flip. So you're on top of your toes. Now put your hands on your thighs. Make sure your knee is in alignment with your hip. Push up. Now lean back, lean back, lean back. Put your chin up, put your chin up, put your chin up. And stretch back as far as you can. And that will be one of the fascial lines that you've just elongated. So, sometimes we'll see this in yoga or some of those movements, but I've watched a lot of people doing yoga. I've actually participated in some of the yoga, and they're not always moving in alignment. They're moving, and so I've have friends, and they love yoga. We all love yoga or those types of movements. It's great. But if there's more attention given to the position of the foot, you will never, ever elongate that fascial line that we just did if the foot is in a pronated position. Just won't happen. It's not activated. So if we can pay attention to the position of our foot all the time, which is what a lot of us do as a CPed or a podiatrist or somebody that's working with our patients. But I see it all the time. Go to a store, all of your patients, everywhere I go, people are not activating. People are walking, great for them for going out and walking, but I see the biomechanics so bad, they're not activating their fascia. They're going to struggle, let me put it that way, to get rid of their belly fat, to help with their circulation, because if that fascia is tight and it's pinching those nerves and it's pinching all of those blood vessels and you're sitting in a slouch position, how many people do you watch? If you haven't paid attention, watch people. You're all looking at people walking in biomechanics. Most people walk with their shoulders forward. We don't activate the fascia that way. We actually activate the fascia with our shoulders, with our hip, and align with our ankle. And then if you were to stand up and push back on your heel, you can try it if you want. Push back so the weight is on your heel. You'll actually feel the core more activate, and that also increases the fascial lines. So it's quite fascinating for me, and I hope it is for you. My goal today is to just have you be aware of how big this fascia concept has gotten. It's not just fascia. It's not just a little bit of a tissue. It's not just something that we can cut. This is a full fibers of this matter that goes everywhere throughout the body. It will affect every move we make. We want to involve the fascia. Our bodies will be much healthier. Our bodies will be thanking us for being that person. Let me go back to share. Let's see. So when you move, maybe some of this you'll like for yourself, we want to move all of it. When we make one move, when we do one little finger move, when we change the finger move to make it so we're in alignment, you can actually get a cardio workout working your fingers and your feet sitting in a chair. So it's just a lot of fun. And you can see those resources. You can look at those. There's a lot of resources out now because this has been coming very large in the last 5 years. Again, I've been working in this area for almost 20 years. Each year, as something comes new, I've just been fascinated with the information that's coming out. It's so linked to what we're all doing. And if nothing else, it's just information that can be passed on to somebody else. It's actually rare to find someone who has a high knowledge of how to manipulate and work out the fascia. Massage therapists will move fascia with massages, but this is actually a little bit different technique. It is you as your own machine with no weights, no equipment, no anything, can activate your feet, position your feet in a different way, elongate your fascia, and your body will thank you. Your body will have all kinds of health benefits. The list just goes on. We've already talked about some, but for all of us, if we can keep track of our feet and our fitness and our fascia, then we'll be all a lot healthier. And again, our bodies will thank you. And thank you for asking me to come on and just giving you a little bit of a snippet of the fascia and the feet, how it's connected, and how we can get fit by using our feet and our fascia. Let's see.
Just hit the stop sharing. Yep, there you go. Awesome. Wow, that was fantastic. Those the exercises were not that easy, actually.
They're not. They look like they're really simple. I used to have an office inside of a fitness center. I mean, COVID has changed everything in our life and moves on, but I had a wellness center and I had one of my offices in the fitness center. And so I was in one of the rooms, I had glass, and I'm working out with patients with some of these techniques or with clients. And, a lot of the guys were there lifting and people were there and they're running on the treadmill and they're working the elliptical and they're doing all these things for hours. And they would watch me with my clients because I was not just a fitness trainer or a specialist. I also brought in a lot of the health concepts. We can help our, how do we get healthy fascia at all? Mm-hmm. We have to move, we have to hydrate. I don't teach kids who are around me anymore about go drink water. It's about you need to hydrate. Mm-hmm. So even if you have children, they need to learn to hydrate. How many of our health challenges are hydrate? And mm-hmm. nutrition, it causes a lot of inflammation if we're not working our fascia. Mm-hmm. So, and we've all seen that, right, as CPeds in our feet. So mm-hmm. if you have certain nutrients and anti-inflammatory nutrients, things like that. So I was working with that as a full spectrum with my clients. And, you hardly look like you're moving sometimes. Here these people are out on the floor working 2 hours. I would see them every day coming in for 2 hours. They weren't getting a whole lot of results all the time. They were being exhausted. People are coming in from work. They're working 2 hours and they have to go home, take care of their kids and everything. And my clients would very quickly start shifting, and they used to laugh, especially some of everybody's who's pumping up and everything, and they would laugh at the whole thing. So I would have them come in and say, well, try it. Mm-hmm. And when you try, just the understanding and learn some of the concepts of the fascia, how important it is, how you can manipulate the feet, the arms, the hands, to make you in a different position, and really paying attention to what we all know. All of us on this call probably really understand biomechanics, or at least some of those concepts, but really how important is that, and are we really doing that to ourselves or people? And so if I did like a 5 to 8 minute workout, you'd probably be sweating.
Yeah. Well, I also think, it's as we're seeing in a bunch of the comments, I mean, it's people you're not thinking about it, right? So, and how do you take this and help your patients with it? Because patients, are going to be overweight and diabetic and not moving enough. And so how do you take what it is that you're sharing and apply it to your patient base so they can get healthy, right? I mean, that's sort of the whole gist of it. And I think if we're thinking about it differently, as you've presented today, I think it's opened a lot of people's eyes. I mean, we're hearing great information, great introduction to something I never knew. I mean, we're talking about a group of clinicians that are,
right.
We're very much enlightened by, what you're sharing. So it's really, really fantastic. I'm wondering if there's any questions. I mean, is anybody in the audience? Oh, somebody did ask if you had a video, if you had a CD or.
No, we've been thinking about doing something like online, like on YouTube or something.
Yeah. I think it's great to have that available.
Some of this has just been, evolved over the years, my contact with different people and learning different techniques, changing up things, and, kind of going back to my first client. Anybody know who that is? Anybody want to guess who that client was? My first client?
You.
Yeah.
Good, Sylvia.
Okay, Sylvia.
Sylvia should win a prize for that one.
You should. I don't always tell everybody that, but I had been in the fitness world for many years, and I didn't know that. I'm not surprised that some of us don't know that, and I think because I came from the health, fitness, wellness world, rehab, and kind of flipped into the pedorthist, I'm not sure if I would have gone the other way around, I really would have paid a whole lot of attention to that. And so when I was actually very ill, and I had a lot of education, and I just never heard of anything like that, and how to, I mean, we talk about hydration, but we're not always I never heard about hydrate your fascia. I mean, did anybody talk about hydrate your fascia? I've never even heard that hardly. I still don't hear that. I see it once in a while out online. It's starting to come out, but we don't talk about that. We always think it's just this dry material, but it's not. And so when I started kind of playing around with that and learning about it and training with different people that had a lot more education than I did, I was just floored. My goal was to help decrease pain, because if you go out online and look up fascia decreasing, and pain, how that's connected, you're going to start seeing a lot of material on that. I mean, our patients are in pain all the time, right? I bet some of you sitting there are in pain all the time. I was in pain all the time, like all the time. And I couldn't even hardly wear a pair of shoes. That's why this has been fascinating for me from a pedorthist point of view, because I could hardly wear a pair of shoes. My feet were so in pain all the time that it was very difficult to wear shoes, and then forget about any cutesy shoe that a woman would want to wear. I mean, I was like my patients. I get my patients because I was one of them. I had inflammation of the foot and edema and all kinds of crazy stuff going on. So I just had no idea it would do what it did. It just wouldn't. And, it's 18 years later.
Yeah, it's amazing. How does it affect, or how would it affect a patient with diabetic neuropathy?
When you move the body, first of all, they need to be hydrated. Secondly is when you move and pay attention to the position of the foot and it's about alignment. A lot of us know a lot about alignment. Is the ankle and the knee and the hip. I mean, our speaker before was talking about, showed the plumb line. I mean, podiatrists are doing that all the time. Is everybody crooked or whatever? When we're crooked, and that's kind of, a funky term, but this is a lot of things that happen from the brain down to the foot. Okay, so we need to activate and try to move the nerve transmission from the head down to all of our extremities. Mm-hmm. So we talk about neuropathic patients with the foot, but they also have trouble with the hands. Some of us know that, some of us don't know that. Mm-hmm. My uncle always did this. I couldn't figure out why he did that. Well, he was a diabetic who ended up having an amputation because he stood on a nail and nobody caught it for almost 3 weeks and they had to amputate part of his foot. So we have this. So when we're sitting in a position like this, or we're looking down, or we're doing anything that's not in alignment, that nerve transmission cannot get optimally from the head all the way out to the extremities. It's like a kinked hose. Okay. So when you are in alignment, moving the fascia will actually, and I've never heard this hardly in the world of neuropathy or any of those neuropathic issues, but the fascia will actually bind up and pinch, like a pinched hose, the blood vessels and the nerves. So when we're always talking about cardiovascular, what do we all think about? I do the same thing. Heart, is there a blockage someplace? Was it the heart? What is it? Why isn't it getting to the foot? What can we do? Can they get into cardio? All those kinds of things. But the fascia will actually pinch those blood vessels. They'll pinch the nerve vessels also. And the fascia holds more, I don't know if any of you caught that, but it holds more nerve endings than the eye and the skin.
Wow.
So if you can activate that and work with that over a period of time, it will actually help people who have neuropathy and start to reverse, because it repairs just the whole body. I mean, you could see what happened to that person. It repairs, redoes it, it just starts to activate it, and those now nerve transmission signals can now get all the way to the foot. So I have seen I've had many patients, people that I've worked with who has a reversal. Will it reverse it all the way? I don't know. When I was looking for pain relief, I was just looking for some, my life was transformed over making some, what I consider minor changes. I mean, I'm not driving in my car and working out for 5 hours. And I'm not doing all these crazy things. And it's a lot of things you can incorporate into your day. We do have to pay attention to what we eat. Probably some people would get some results with the whole concept without that. But if you can, that's what I do. I'm a health and fitness person. So I mesh everything together into one, and then we see results go from here to here. So I don't know, if I was a neuropathic patient and I could not lay in bed feeling the prickly pain and the ants crawling on my legs, for me as a person, that would be a benefit for me, right?
Absolutely. Yeah. How many treatments do you typically do for a patient, and is there any insurance coverage?
Yeah, unfortunately, I've tried for years and years and years. Our insurance companies do not like wellness, and it's not considered a treatment. So they won't pay, unfortunately, for anything. I have tried so many times to have them look at it, and it's just, I don't know.
And how many treatments do you typically give to a patient?
Well, I don't really like to talk about it as a treatment, but my optimal, if I'm working privately with a client, my optimal time is 90 days.
Okay. And how often do they go per week?
Pardon?
How often do they come per week?
A couple times a week, but I teach people how to incorporate things in their day. What can they do? 15 minutes. I mean, you saw my transformation, right?
Yeah.
Okay, that was never more than 15 to 30 minutes a day with no equipment.
Beautiful.
You know, if I would have been ready before COVID, you know, I mean, I don't do things too much online. But I mean, how many people could this be helped because everybody's home? Everybody's been gaining weight. Everybody has all these health challenges. So, but I put more people on a health program for 90 days and they will see a huge shift. And then, you know, 15, 30 minutes a day is all they have to spend to help to start to make reversals. So, yeah.
Awesome. Well, we got to move on to the next session. Yeah. You're going to be in the roundtable. Amazing.
I will. Thank you.
Thank
you so much.
All right. Take care.
Thanks.